Clean gloves. Wearing clean gloves as a protective barrier for the medication aid is required as part of standard precautions every time you come in contact with blood or body secretions, including saliva. Clean gloves are also used in medication administration to protect the client and medication aid when applying eye ointment or drops, applying medication to the skin, or coming in contact with broken skin or the genitalia, area around penis, vagina, or rectum. Wear gloves when applying creams, ointments, or a suppository to the vagina or the rectum, or when you may come in contact with blood or the potential infectious secretions. Gloves should be removed immediately when you finish a task, and hands should once again be washed. Anytime gloves are visibly dirty, contaminated, or soiled, they should be removed as soon as possible. You should wash your hands immediately to protect yourself and your clients from harmful germs. New gloves can be applied anytime they are needed to complete a task. Busy medication aides may feel that wearing gloves takes care of hand hygiene, but that is not true. Gloves are not 100% effective in protecting you or your client. The use of gloves does not decrease the need for good hand hygiene, neither does good hand hygiene decrease the need for gloves. One does not substitute for the other. It is very important to wash your hands or use alcohol-based hand rubs each time gloves are removed, since gloves only reduce contamination by 70 to 80%. Disposal of gloves. Gloves need to be removed in a manner that does not contaminate the medication aid. Disposal of used gloves varies between agencies. Some agencies do not want you to throw away the gloves away in the trash can inside the client's living space, such as the room. In these cases, you must throw away your gloves either in the medication cart or in the nurse's station. Check the agency's policy regarding proper way to dispose of gloves. Clean glove procedure. Clean hands before putting on gloves. Select proper size of gloves: small, medium, large, extra large. Put on the gloves. Perform tasks. Remove gloves immediately after administering the medication or performing a task. Remove gloves inside out without contaminating yourself by grabbing the glove on the non-dominant hand at the palm with the other hand. Pull off the glove and crumble it into the other hand. Using skin against skin, run fingers inside the other glove at the wrist and slide off hand. Trapping the first glove, remove inside of the second glove. Throw away gloves according to your agency's policy, being careful not to touch the trash can lid. Wash hands. Key points. Anytime gloves are dirty, contaminated, or soiled, they should be changed. Hands should be washed. Do not wear the same pair of gloves from client to client. Do not wash your hands with gloves on. Gloves do not hold up to washing and no longer protect you or the client to whom you are giving care. Do not roam hallways with gloves on. People do not know if they are clean or dirty. Care for your hands. Give your hands a chance to be without gloves. Hands sweat inside of gloves and need a chance to be exposed to air to dry. Because you are asked to wash your hands often, pamper your hands with lotions and creams between washings, and also when you sleep to keep your hands and nails healthy. Use lotions that are squeezed from a tube rather than those that you have to dip your fingers into to get the lotion. Dipping your fingers into the container introduces germs and contaminates the lotion. During work time, it is important to use water-based lotions versus oil-based lotions. If your agency uses latex gloves, the oil-based lotions will break down the gloves and they will not be as protective.